report saying asymptomatic people may not spread this disease after all, and maybe we should be worried about people dropping the disease and not necessarily assuming everybody got it. How does your team do that on that question?
I've only read the articles. I haven't read the study. But based on the articles I've read, the World Health Organization drew this conclusion from very small sample sizes involving a few contact tracing programs in a number of countries. I was on a call this morning with a bunch of folks from the healthcare community, all of whom basically said they were enormously skeptical of that conclusion for a whole bunch of reasons, and so am I. I mean, I'm skeptical of it for I'm skeptical of it for several reasons. The first is, in the antibody testing that's been done on a small-scale basis in Massachusetts, every single antibody testing project that's been done in Massachusetts, huge numbers, huge percentages of the people who tested for the coronavirus antibodies, which means they were infected and shedding virus at some point, said they were never sick. Okay? Point number two is there is a lot of anecdotal information about the impact that asymptomatic workers in long-term care facilities had with regard to the spread of coronavirus in many long-term care facilities. And finally, there have been a number of very serious scientific studies done on the spread of the virus in other parts of the world that are obviously ahead of us with respect to how much experience they've had with it, in which more than 50% of the spread of cases were deemed to have been delivered by people who are asymptomatic. And the other thing I would say is that there's two pieces to the asymptomatic population. The first is, how many days is somebody asymptomatic before they become symptomatic? No one's disputing the fact that those people are infectious, all right? The second is the sample size associated with what the World Health Organization drew a conclusion on, and I'm not an expert here, I'm just relying on what I'm hearing from the people who are, was deemed to be enormously small to make that big a declaration. I continue to believe that based on the advice that we're getting from the health experts here, that people who are asymptomatic, who become symptomatic, are absolutely capable of spreading the infection, and so are many of the asymptomatic people who never show symptoms at all. And I would urge people to follow the feedback and the pushback that's going to come from that broad declaration yesterday from a lot of other people who've spent a lot of time trying to figure this virus out. No question, it's unprecedented. No question, we're learning about it as we go. No question, people are changing some of the guidance and the advisories based on information as it becomes available. But I am enormously skeptical of such a broad generalization about something where there is so much data and information already available that says just the opposite.